Two approved COVID-19 vaccine brands are currently being rolled out across the U.S. One is Pfizer-BioNTech, and the second one is Moderna. I got to speak to one of the medical frontliners who got a jab of the Pfizer vaccine. Our kababayan nurse practitioner Pamela Surla-Milligan shared her experience from Los Angeles.
I got my immunization in December, a second week of December, the first dose. So the first dose was actually pretty easy. I just had a little bit of soreness around, the injection site. But other than that, maybe a little bit tired. But after that, it was all good.
What about the second dose? Was it any different from the first dose? Did you feel also any side effects?
Yeah, so the second dose was a little bit more challenging. Again, a little bit of soreness around the injection site, but 24 hours later, you kind of feel, I felt a little bit achy, some chills, maybe CNAP, like low-grade fever. So it was kind of like a case of a 24-hour mild flu, but the day after that, I was back to normal. So I just, of course, I also had some colleagues that didn't have any side effects between the first and the second dose. So I don't want people to be discouraged from, getting the vaccine when it's offered to them.
And what you just told us, Pamela, has really been quite good news and very encouraging for our fellow kababayans here in the Philippines who will be inoculated with several brand vaccines over the next 6 months. And of course, the last year, 2020, and as we enter 2021 has been really tough for all of us, especially for you guys in California, which has the highest number of infections and deaths in America. How does it feel that there is now a vaccine that could hopefully stop this pandemic?
Rico, it feels good, right? Like that we have this vaccine. It gives us hope, you're right? It gives us kind of the feeling that finally there's a light at the end of this dark tunnel that we've kind of been on this entire 2020. So hopefully as we get more people vaccinated, we can finally get a hold of this pandemic, start seeing numbers improve. So I'm really hopeful that our lives will regain some normalcy and we can travel again and enjoy the world, enjoy our families, each other's companies. So yeah, I'm looking forward to finally seeing my extended family again and hopefully someday soon be able to come back to the Philippines and visit family there too.
That's true, because over the next 6 to 9 months, a lot of our kababayans will be immunized with many brands, Pamela, being ordered by the Philippine government, from China's Sinovac to India's Covovax, the UK's AstraZeneca, and other brands in the pipeline. As a nurse practitioner, should our kababayans trust all of these vaccines as we continue to fight this coronavirus battle?
I mean, ideally, Rico, right? Like, I think we should, right? So ideally, we should have a choice, right, which vaccine we get. But even here, like in the United States, we were not given a choice. So most of us had Moderna or Pfizer available to us here. So, but given that those two vaccines are very highly comparable, to each other, their effectivity rates are like in the mid-90s, I think, with Pfizer being 95% and Moderna 94.5%. So I know that I've heard that the variation of vaccines that will be available there in the Philippines does have some variability, or the data isn't quite in yet as far as their effective rates. But, I think like some immunity to COVID is better, right, than absolutely none. So, yeah, I think we should trust the data.
Yeah, because the plan here in the Philippines is to have about 60 to 70 million Filipinos out of the 110 million population to get immunized. So we have that herd immunity. And Pamela, it must be challenging day in and day out with you being a nurse practitioner at the hospital. I mean, with the many infections, not only in the hospital, but of course around you as well in the community and those passing on. Where do you get your strength and resilience during these tough times?
I think that when you enter a profession in the medical field, right, like such as nursing and such, you kind of generally have this innate desire, innate characteristic to help and care for others. So these are unprecedented times. These are like some of the most challenging times of our lives, emotionally, physically, spiritually, professionally. So personally, I think I draw my strength from my family, right? My children. I want them to have a good future. I want them to have a future, period, right? From our patients, from our colleagues, because we're all in this fight together against COVID. So we want to do our best for our patients. So because Rico, this can happen to anyone. So our
Yes.
patients, that's someone's mother, that's someone's father, someone's child, right? So you just hope that if it is your family member that's laying in that hospital bed, that they're receiving the best and the most compassionate care that they can receive from the medical professionals around them.
And what is your message, Pamela, for fellow Filipino nurses and healthcare workers in America and everywhere in the world who are fighting this battle with you against COVID-19?
Yeah, so I just, first of all, from one healthcare provider, right, healthcare worker to another, I want to say thank you to all my fellow Filipino nurses and healthcare workers for continuing to do your best, for all the sacrifices that we all make together, for putting yourselves at risk day in and day out, and for showing up like every single day to the point that, they leave the safety of their homes, they leave their families behind to care for strangers, for others, right? So I want them to keep strong and have faith that, hopefully better days are ahead of us, that now we have this COVID vaccine, and hopefully this should give us hope, to end this pandemic that we're in.
Pamela Surla Milligan, a nurse practitioner at the Children's Hospital, Los Angeles. Thank you so much for joining us on The Final Word.
Thanks for